Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today. I'm your host, Sharlee Dixon. We're excited to welcome Dr. Nicole Dolan back to our show today. Nicole is a writer, former clinician, and intuitive coach whose work blends depth psychology, spirituality, and lived experience as a mother. Her forthcoming book, The Art of Chaos, explores how her world fell apart and how she discovered meaning and resilience in the midst of trauma, motherhood, and raising a neurodivergent child. Drawing from her background as a clinical director and her transition into holistic family coaching, Nicole helps parents and families uncover patterns, heal generational wounds, and find strength through conscious parenting. Passionate about creating space for authentic stories, she guides others on the path toward healing, wholeness, and deeper connection. I'm excited to welcome Nicole back to our Clinicians Series, where we take listeners behind the therapy door to explore strategies and approaches that truly support mental health. In this episode, we explore how Nicole bridges clinical psychology, neuroscience, spirituality, and lived experience to support neurodivergent children and their families, uncovering what traditional approaches miss, how parents can regulate and heal themselves, and how clinicians can develop the skills to work effectively with neurodivergent family systems. We're really excited to have Nicole back on our show today. Welcome back, Nicole.
Thank you so much. I'm excited to be here again.
Absolutely. So let's just dive right in. On our last episode of BHT, you shared how you went from being a clinical director with a PhD in psychology into holistic family coaching, largely based on your own experience of raising your neurodivergent child. Looking back at that time, what did you realize was missing in traditional clinical work with neurodivergent families? Where did those standard models start to kind of fall apart or fall short for you personally and professionally?
Yeah. So I want to say first, just to kind of reorient us with my world of psychology. So I'm a depth psychologist. So I've always lived in kind of a different way of practicing, anyways. And as a depth psychologist, we basically, if I try to say it in a nutshell, which is nearly impossible with Jungian work, we look at symptoms such as depression, anxiety, and we say, what does the soul want? How is this a pathway to listening to something deeper that's going to lead us to our soul work or who we are on a deeper level? And so when I got into the world of neurodivergence, that's, to me in the beginning, felt like the opposite, right? It was like, okay, now I'm being brought into like neuroscience and why and what's happening. And at the end of the day, to answer that as simply as I can, I would say what was really missing was the nervous system. We weren't talking about the nervous system. So
Yeah.
I imagine that's where we'll go with that today.
Absolutely, absolutely. And so I know, again, you made a kind of a large jump from being clinical director professionally into, holistic family coaching. What was that experience like for you?
You know what? I'm still on the journey. I'll be
Mhm.
completely honest. It is one of integration that has not integrated fully because I keep
Yeah.
trying to land in one place and be like, okay, now I work with neurodivergent families, right? But I also wrote a book that brings me other places, and I've just recently been asked to work with veteran populations, et cetera. So
Mm.
when I come to a place of my own journey of integration with it, I say to myself this, I say, I work with adults who are in chronic dysregulation and also with children and families. So I work with the plethora of people, right? But I think when we come to the heart of like when we are suffering, what does it mean? Well, what it means to me is it's a pathway to truth, meaning, soul, whatever it is that's calling us to go deeper. So kind of a hard question to answer, but to say it as simply as I can, I'm in the process of really integrating that myself. And as I try to niche, as I have over time, I
Yeah.
have found that there is no niche for me because we're all humans on this journey and we're all, we all have nervous systems. So however it's
Yeah.
showing up for us, I'm finding that that's kind of the lens that I'm seeing things mostly through.
Got you. Got you. And something that you said the last time, you actually kind of alluded to it here too. You said everything that we were taught was for the neurotypical brain, right? And I honestly thought about that even in my own educational experience in social work. We weren't necessarily taught a lot about how the brain works, period, but then also how a neurodivergent brain works differently from a neurotypical one. So for the clinicians that are listening today, what actually breaks down those neurotypical frameworks in converse to neurodivergent kids? So what kind of things can we kind of not necessarily forget about, but can we place to the side when we begin to work with neurodivergent children and their families? So I know there are some new skills, new ways of thinking. Can you tell us a bit more about that?
Sure. So I think one of the most important reframes is for us to maybe stop looking through a lens of behavioral and pathology
Mm,
and instead see through the lens of regulation. So I recently had somebody come to me and they said, our child was just diagnosed with ODD, right? Oppositional defiant disorder. For me, when I hear about a child who is not just acting out, but more specifically is unable to regulate and or co-regulate. For me, I hear that through a lens of, okay, I have a child that has a nervous system that is lacking the capacity to stay regulated. And that's meaningful to me. And it's a big shift from the places where we've come and where a lot of schools of thought still are, where it's like, okay, this is behavioral or
yeah.
this is pathological.
Right, right. I completely agree with you. A lot of the conversations around a lot of, especially childhood issues, are about behavior and how can we fix the behavior, not necessarily how we regulate their
Yeah.
emotions or how we regulate how things go, or even as a parent, how we respond to that. Because I know, especially with children with ODD, trying to work with that child and really reteach ourselves how to parent is a huge piece of that.
Yeah, yeah. And I mean, I have to say, for me, it's one of the most offensive diagnoses that are out there, right? Because it's literally saying this is a child that we don't really know where to put them anymore. They just don't conform or fit into any of these boxes. And so we're going to pathologize them and say something's wrong with them. And so for me, I'm like, there needs to be a huge reframe and a huge understanding of nervous system science, right? We might be having, and we're talking about children here because we most often are seeing, it's more about like early intervention when we're working with neurodivergence, but of course,
Mhm.
adults are neurodivergent too. But speaking of children from that perspective, it's like, whether you're seeing it through the lens of like autism, ADHD, sensory processing disorder, those are the names, if I had to diagnose, those are the names that are coming through to me as opposed to looking at somebody and saying, you're oppositionally defiant, right? Or something's wrong with you or,
Right.
so yes, it's a huge reframe.
Absolutely. And so where do you suggest that clinicians get these new skills or even these new thought processes? Because again, these are not things that are generally taught in regular educational programs.
Yeah, so that's a great question. I think that there's not enough resources. I would say that I am a resource on this if you need support. And more of us are talking about it at least, but it's not taught in schools. So luckily, I think as clinicians, a lot of us are queuing into the nervous system in general. We're starting to understand how the nervous system works, what the sympathetic state is, what the parasympathetic. We're starting to understand, the function and importance of the vagus nerve. So when you say where do you get that information, I would say, first educating yourself on the nervous system, I think is going to be really supportive. But then also what comes to mind is honestly collaboration too. Like it's not common these days at all that I'll have somebody come to our practice. I have a large nonprofit, so I have therapists that are practicing under us. And it's not common that we'll have kids come in like this and I'll say, oh, okay, we'll treat them in therapy. So, what I mean by that is we'll treat them in therapy from the perspective of attachment work, maybe working with the parents and certainly the family. Like, so if I'm doing family work, by the way, I'm working mostly with the parents. But the kids, right? It's like we can do attachment work with them, we can do play therapy, we can work with them to build regulation skills but there's more going on for these kids than people realize. So it's most often that we're also bringing in occupational therapy or neurofeedback or neurosensory integration. There's a lot of different supports that we are leaning towards integrating because you have, neurobiology that is different than another child that's coming in to play. And you have a lot of things need to happen with the body. I guess that's an important part is a lot of things like in something like occupational therapy, for those that don't know, occupational therapists are going to be working with the body. So these kids often have undeveloped core strength. And if you
Mm.
can start to get their core to develop more and to come more online, they will actually start to regulate better. People don't know that, right? And as a,
Yeah.
marriage and family therapist or a social worker, we don't know that because we're not taught that. So
Right.
there's body-based therapies that really have to start to come in. There's things that parents need to understand that are going on, even just to normalize the experience of like, hey, why is my kid, acting this way? Because often it does look behavioral.
Hmm.
I think that's one of the craziest parts about it. The joke that I often make to these parents when I work with them, I'm like, listen, if you saw me in public with my child, you just think I was a bad mom.
Yeah. Yeah.
Because it looks behavioral. So it's it's not to say that we can't help support them in therapy, but my belief is who we can really support in therapy is the parents. Because
Absolutely.
we can normalize, we can psychoeducate, we can
Yeah.
teach them what's going on, we can teach them to co-regulate these children. We can also
Absolutely.
start to work with them and their nervous systems because another belief of mine is these are all just very highly sensitive people.
Yeah.
Yeah.
That is a belief I've heard and can agree with as well. And so I'm glad that you mentioned nervous system parenting and kind of how things that we've experienced in our childhood or we grew up believing kind of make imprints on
Mhm.
our nervous system and how that impacts our parenting. So that is another thing that we discussed in our last conversation is a nervous system imprints. Can you discuss that in practical terms and how do parents start to notice what their own imprints are?
So, and it kind of goes back to the first question you asked, because what comes in there is it's like, yes, now you have it starting to integrate. Now you have both components coming online. So, when we are in a situation where our child is activating us, I think a good question for us to ask is this activation because of something that maybe is coming up in my body from the past, which is a big question to ask, right? Like it gives us, for those of us who have never tapped into that, that's a big question to ask. You might not be able to decipher what it is right away, but the question is this something that's getting activated because my child's bringing up something in me that's unhealed, right? Maybe my child is expressing these big explosive emotions and I was not allowed to have emotions. So that is very uncomfortable for me and it's making me feel really yucky in my body. Maybe that's the answer.
Yeah.
The other answer might be that I am dysregulated right now because I'm out of my window of tolerance and I'm actually experiencing more of like, say, chaos right now because of my own highly sensitive system.
Mm.
So it's like, I think really in the beginning, we start to really decipher the difference between is this something that's asking to heal, or is this something that's asking me about my own level of regulation? So we have to kind of get clear on like what support do we need right now for ourselves. And I think that's just the beginning of tapping into if I can figure that out for myself, if I can do that work for myself, then I can begin to support my child. But you can imagine right now if you're feeling into that, right? And you're like, well, I don't even know where to start, or maybe I've done a little bit of that. Imagine what your child, or your child client is experiencing when they're having a moment of dysregulation or distress. So we really have to start slowing things down and getting more clear on what's happening.
Absolutely. Completely agree with you because we talked about a bit about this again in our last conversation. As a parent, it is difficult in that moment of activation to learn to okay, let me slow down. Like, what am I really feeling in this moment and why? Where is my own feelings about this coming from? Where this the feelings about their behavior coming from and my reaction to it. What is that about?
I had an experience recently where, so I have a partner who, when he's in distress, instead of like when he's upset inside, instead of showing like sadness, like he'll show up, like his face will look angry, to be honest. And it's like, why is that so challenging for me? Why is that so hard for me? I have somebody saying like, I'm not angry. I'm like, well, you look angry, I promise, you know? And I had a moment where it's like, it took time. Like it didn't take me that much time, but I'm also like an ultimate processor. That's what I do and help people do. So
Right.
it takes time, but through like really leaning into that when I was regulated. So not in the moment of dysregulation where I'm feeling dysregulated right now by the look on your face, right? Instead of that, it's when I'm regulated, taking the time to really lean into that and say, okay, what's happening for me when my partner or my child is angry, right? Well, is it because I feel disconnected and that feels really scary to my attachment system? Or is it anger in general is scary? Okay, well, and as I sat with this is a very personal story, but as I sat with it, I was like, why does this feel so scary? Like, I don't think anyone's ever like yelled in my face before or treated me a certain way. But then I was able to like really pull up, you know what, when I was a kid and I was an Irish dancer. And so I
Mm.
competed all over the world at one point. And
Yeah.
I had a choreographer that would come in, every summer, and I was very, very young, and he would yell at us. I mean, he would yell at us, he would throw chairs, he was so angry. That lived somewhere in my body, right?
Mhm.
I'm in my 40s now. I was 4 when that started and 13 when it ended.
Wow.
So it's that lived somewhere in my body, and it took time to be able to locate that. And certainly I think it takes guidance and support to get to those places. But it really is true that we have these imprints and they live in our body and in our systems, and they are getting activated in our relationships and often by our children.
Yes. Absolutely. Just that conversation, that piece of that takes me to a book, The Body Keeps the Score, because it absolutely
Mhm.
does. It holds on to those things, and it tends to come out in the little recreations of ourselves and our children.
Mhm.
Absolutely. Yeah.
Mhm.
So
Yeah.
when you are beginning the process of working with a family, what does that intake or assessment process look like? What does it feel like for clients?
Yeah. So honestly, I can spot this through an email. So I have a nonprofit organization where we have therapists that are training to get their hours. And so they work for a holistic company that I have called Sacred Path. And we have an influx of referrals that come through. And whenever I see somebody with a behavioral issue, they're usually sent to me. And it's because it's
Okay.
usually 9 times out of 10, not a behavioral issue, it's a
Mhm.
regulation issue. So if I
Yeah.
ever, or when I've been coaching or when I've been as a clinical supervisor in the room with therapists who are saying, like, hey, this kid's getting in trouble or this is what's happening for them, I spot it right away. And so what I'm looking for is dysregulation, reactions and responses to stimulus that do not match what's actually happening in the moment, sensory type meltdowns as opposed to tantrums, right? Like there are
Mhm.
children who have tantrums, which usually end around age 3 or 4. When tantrums continue and they're not, you know, something that you can shift by diverting attention or, giving them what they want, right? If you have a child that's having a sensory meltdown, you could give them anything that they want. It doesn't matter. It's not going to stop it because the problem isn't that they're fighting for what they say that they are. And
Yeah.
that's the irony is that they're actually just in a completely dysregulated state. So I'm paying attention to behavior and what people are reporting as behavior, things that people are saying are going on. And then I know at that point that it's like, okay, we have a child that's struggling with regulation. I mean, I would just be asking these questions, right? I'd be asking
Yeah.
these parents about this. But really, like I said, I work a lot with the parents because
Mhm.
I really feel like these kids have come here to heal us. I mean, they've come here to the ones who are, let me say it this way, and this could be a very spiritual philosophy of mine that I don't push on anybody, but if you're curious about it, I hold it in this way where it's like the ones who have come to heal us individually as parents are the ones who are, overstimulated and highly sensitive and activating and maybe strong-willed, difficult. And then you have the ones that came to heal society, and those ones are the ones that are impossible to raise, by the way. Those are the ones that conform to no one. They have no interest in adults, authority, anyone telling them what to do. They are not going to sit in the same boxes that you or I did. And those ones are the ones that are raising hell and getting the ODD or the bipolar or the whatever crazy diagnoses that are getting thrown at them. So for me, I'm really paying attention to like what level of dysregulation are we dealing with? What does the family system look like, right? Do you have parents that are like, let me drop my kid off once a week so you can fix them? Or do you have
Mm-hmm.
parents that are like, I want to know what I can see within myself that might be supportive to help this child? Do I have parents that are open to the idea of conscious parenting, which is Dr. Shefali's work, which very much says that whatever it is that your child is acting out is meant to heal or activate something within you? So just really paying attention through that assessment of like, what is the story of this family? Who are the people that I'm sitting with? How is this child being held within the system? Maybe what did this child come to heal within the system? And then is this system open to this approach? Because some people don't want to take this path, you know.
Right.
But these kids are very loud and they're very intense, many of them. And so they're also forcing us to change. They're forcing us to awaken.
Absolutely, absolutely. And you mentioned earlier about the window of tolerance, and it really, and just in that conversation of speaking about how how parents or how you bring them in, that what that assessment process looks like. How do you begin to then take them? Oftentimes, parents who are kind of at their wits' end, they too may believe that this is a behavior problem. They may be feeling down about themselves because how in the world do I have this child? Like, what did I do? How did I bring this about? How can I be better? What did I do wrong? How do you take them from that level of understanding or lack of understanding to a place where they understand what a window of tolerance is and how they can manage their own issues to get more help for their child?
Yeah. So, I mean, simply stated, the window of tolerance and the window of capacity is really about building that window of tolerance. So, our window of tolerance is our ventral vagal state, right? So, when we move out of our ventral vagal state, we can move into sympathetic state, which is our fight or flight. And then we also can move down into our dorsal vagal state, which is where we more freeze, fawn, and get stuck. So I think it can be supportive to first help parents understand the nervous system a little bit and what the window of tolerance is. I like to think of the window of capacity or expanding our capacity as becoming flexible within those states. So a lot of us feel like if I got dysregulated today and I lost it or I did something wrong, it's like there's a lot of shame that comes with that, right?
Mhm.
Or even if, you didn't make a mistake or feel like you made a mistake, it can still feel like I got dysregulated and now everything's bad, right? Because our nervous system and our collective psyche likes to believe everything should be perfect. So, so when we have those experiences, it's like it's first allowing ourselves to, understand the nervous system, understand the different states, understand that we do move in and out of them. When we do, it's not by any choice, it's by how our nervous system is responding based on our history and our neurobiology. So I think a lot of it is like normalization in the beginning. If you think, speaking to clinicians, right? Like when you sit down with a client who has depression or anxiety or who has been through a significant trauma, maybe even a sexual trauma, and blames themselves. What's the first thing that you do? You psychoeducate them. You help them understand that the reason that they froze or fawned in that situation, it was not a choice. They did not make that choice. Their nervous system responded in this one way because fight and flight was not available to them. It starts to shift them, right? It starts to bring them from a place of like, I did this, or I like made this happen, or this was my fault, or why did I respond in that way? To, okay, there's something different happening here. This is a biological response that I'm not controlling and I am doing my best. So I would say that's the very first place that I would start.
Got you, got you. And that you mentioned a great point. There is a ton of shame around being seen as not doing the best, right? There is a lot of pressure to become this perfect parent with perfect children. And for one, that's not realistic. But as a parent, that's not how it feels, right? You're in the grocery store and your child is doing whatever that they're doing and everybody is staring at you. That's not what you feel in that moment. And so being able to help parents understand, like you mentioned, their window of tolerance and understanding their nervous system, not just their own, but their child as well, is an important first step to helping see some real change there.
Yeah. And I think one of those important things too is if you do have a child or you're working as a clinician with children, well, this would actually just apply as parents. So I'll say if you do have a child that, resonates in this way, we have to start looking at ourselves because they seem to come from highly sensitive parents too. And so we can start to understand our
Mm,
own nervous systems. And,
yeah.
one of the terms that came through when you were sharing that, whenever I go into the grocery store in my mind, the imagery
Mhm.
that comes is sensory gating. And what that means is basically our nervous system's ability to choose what to tune in on, what to filter out as background noise. And those of us with highly sensitive systems are usually diagnosed in the realm of ADHD because we don't do that well. We don't have a well-gated nervous system, meaning we're taking in all of that information at once. So if we want to start to understand what's happening for our kids, we can also start to understand what's happening for us, right? So if I'm in a grocery store and I'm trying to use my executive functioning system to figure out, how these ingredients are going to last this entire week amongst, switching these meals around, whatever, right?
Mhm,
And
mhm.
then I've got a
Yeah.
kid bouncing on a cart and then one like throwing a ball down, maybe they found like a toy and they're throwing a ball down the aisle and like pay attention to other things, right? Like, are the lights too bright in here for you? Like, is the noise too much? How do you feel
Mm,
in your body around like the temperature? Are you, near the frozen food and maybe that's upsetting you? Like, it's like
mm.
we also take in more sensory information usually when we have kids like this than we realize. So I think it's really starting to pay attention to our own nervous systems and our own trauma histories and really
Right.
working on ourselves. And that's why I say I feel like these kids are really here to teach us. So for me, it's like the parents are doing the deeper work in an ideal situation, right? The parents are doing the deeper work. What's coming up in my trauma history that's being asked to heal? What's maybe coming up in my ancestry that's being asked to
Mm,
heal, right?
mhm.
And then the kids are more doing the body work and the nervous system work around like, okay, what can we do to support this child specifically so that they have better regulation?
We'll be right back after a word from our sponsor.
Are you preparing for a licensure exam in psychology, social work, marriage and family therapy, counseling, or behavioral analysis? AATBS is here to help. We have been supporting behavioral and mental health students to prepare for their licensure exams for more than 45 years, working with over 1 million students to succeed on test day and move on to the next step in their career. With products ranging from comprehensive courses to quiz banks and delivered live online, self-study online, and in print, AATBS has test prep solutions that meet every student's needs and learning styles. Visit us today at aatbs.com. That's aatbs.com and use promo code BHT15 to save 15% off your next purchase.
Yeah.
Absolutely. Absolutely. And being, like you said, just being able to notice those issues within yourself. But that brings me to opposition. Does it happen when you, because again, I have been on the clinician end of something is wrong with my kid. I need you to fix it. I don't know what they're doing. I, I need you to fix it. And discussions about where parents may be seeing things incorrectly or harmful even is not a tough conversation to have as a clinician. And so how do you approach parents who are not understanding that they've got some things to work on themselves? It is not just fix my kid.
Yeah. I mean, I'm a pretty honest, transparent, straightforward person. So I'm probably
Yeah.
just going to tell them the truth of what I see. And if they're open to that, great. Then I'd probably be a great support for them. If they're not, then I might not be. And luckily, I have plenty of other people that I can refer them to. But certainly, just starting out as a depth psychologist, right? Like I'm already working with a certain type of individual, someone that's open to doing their work. So that's probably my answer.
Got you. And even to even take that a step further, do you think that that level of honesty, transparency with folks, is that the best practice? Is that something that every clinician should use, or are there different techniques to being able to provide that mirror with other techniques, I guess?
Yeah, I mean, sure. I think you can provide the mirror by giving information and maybe not making it personal, right?
Mm,
Because
yeah.
if you are sharing the information that we're discussing today and people are like, it's clicking for them, like, okay, wow,
Mhm.
this is what's happening, no matter what we label or diagnose the child as, it still is the set of symptoms that are occurring, right? And that's still what's causing the family or the parent chaos and dysregulation. So maybe they would be more on board without having to look at themselves. So certainly I think that you can, but as far as from a clinician perspective, I mean, what really comes through to me to say is just be yourself, right? I just described it in that way of saying, like, well, this is who I am as a clinician and
Mhm.
as a person, and we all have to figure out along the way. I've trained many, many therapists on the way to licensure. And what I always, always teach them is two things. I teach them how to trust their intuition, and I teach them how to figure out who they are. Like, who are you as a therapist or a clinician? So
Absolutely.
I think it depends on each of us how we would deliver that information. I am definitely on the the stronger end of the spectrum of telling it like it is, if you will.
Yeah.
Yeah.
I agree, because I mean, sometimes it takes a certain level of, hey, you gotta kinda look at yourself. Not that everybody wants to hear that, but it can definitely be effective in helping for people to, like you said, like I said, provide that mirror so that they can really see, and not, again, not to shame or,
Yeah.
make parents upset or people upset about how things have happened, but it's important to really be able to look at yourself honestly,
Yeah.
for any other work to work, for it to actually work and be effective for your family.
Right. And I think that's the key when you say for any of it to work, it's important to look at yourself. Right.
Yeah.
So the other thing that came up when you were talking, I was like, okay, this is another way that you could do it for clinicians listening that want support of like, okay, how do you actually do that? If you have somebody that you feel like is really not going to be receptive, or for you, it's not the language of being, upfront and transparent yet. I would always teach my interns, I said, it's like, well, put on your clinical hat, like don't go into their story, like stay as the clinician, right? You're still holding their
Mhm.
story, but you're not just like going along with them into their narrative of like, maybe you don't know anything or whatever their defenses are, right? So staying true to yourself, staying back here. But one of the ways that you could also, if you wanted to do the work to drop somebody in far enough to be willing to open, right? That's
Yeah.
like a prerequisite. If you want to do the
Mhm.
work to get them there to open, then you could, just like any other therapeutic session, really mirror for them and support for them and ask them questions about their past, right? Like,
Yeah.
what was it like for you when you were a child? What happened when you had a tantrum in the grocery store? How were you treated? What was that
Mhm.
experience? What's your, relationship like with your parents now? Just ways that I feel like in those moments, if I'm working with a client that's more guarded and I want to help them access a deeper part so that they'll come on board to do their work, which I keep saying that as a prerequisite, right? Because we don't have to force anyone to do their work. We can meet them
No.
where they're
Mm-mm.
at. But if
Yeah.
we wanted to, not force, but reach in, I think we could reach in that way by dropping into that empathetic state with them, right? Where it's
Mm.
like, because then they start to feel something themselves.
Right.
And, most parents are
Right.
doing their very, very best, right?
Absolutely.
So if they
I
can
agree.
start to feel like, hey, maybe there was something that impacted me and my life and my ability to be grounded and regulated in this moment, then maybe there's something I can change in myself or heal in myself that's also going to be supportive for my child.
Absolutely. That's really honestly where I was going to go next, is that intergenerational patterns, because we often do repeat them. I mean, not that we even choose to, it just kind of how we are taught is how we continue to teach. And so I wanted to kind of dig into your thoughts about that. How do we help parents? And you kind of already started to answer that question. How do you help parents see that how they are working with their child is how they may have been parented in their own childhood? And then what tools do you use to help parents dig into that deeper layer to really unpack some of that?
Yeah, so I think it depends. One of the things that comes up, well, first off, the language that comes through, and I wrote this in my book, and I hear these words, and I think they're so beautiful. It's just that pain passes through bloodlines, right?
Mm,
So until somebody wakes up and asks, where did the river begin?
right.
So I think that, how many times do we have to see what alcoholism has done to our family, or
Mm,
divorce, or, hostile relationships, or the estranged family, that keeps passing down, or whatever it is. Like,
yeah.
how many times do we have to see that before we're willing to look at that? And also, our generation is a generation of cycle breakers, right? Like, they
Yes.
highly identify with that. So I think a
Yeah.
lot of
Yeah.
them are already on board with that. But for me, it's like, it's about getting a little bit deeper. Instead of saying, like, how can I parent my child differently, or how can I do something differently than what my experience was, I think it's more like paying attention to, like, once again, coming back to, like, how does your depression or your anxiety or your chaos, dysregulation, pain points, like, how are those showing you the pathway home of your own healing?
Mhm.
Because I feel like there's just so much more depth, rather than like the logistic of how can I, parent differently. It's like, well, what was the pain that was passing through the bloodline that still exists today, that's showing up in these different ways, that's being asked to heal and is being triggered? It's being asked to integrate. And what's the point of that? It's like, well, yeah, it's to break cycles. It's also to build new systems. And it's
Mhm.
also to heal and remember who we are. One of the greatest aspects of psychology that I really hold and value is that we split off from parts of ourselves along the way. It's not that we're broken. It's not that anything's wrong with us. We just
Mhm.
have to go on a journey of reintegration. We have to go back and collect all of these parts of ourselves so we can really remember who we are. So I mean, there's such a gift and a blessing on the other side of doing the work. And yeah, and I also have this sense, I mean, I am not the tell all for this, so I don't know, but I have this sense too that just like our generation is saying, like, oh, we're the cycle breakers. I also
Mhm.
feel like our kids didn't really come here to do that. They're more
Mm,
like here to build new systems. That's why they're
yeah.
pushing back so hard. That's why they don't fit in the places that we were all able to conform to.
Absolutely. Absolutely. I can definitely see that. I can definitely see that. And so are there specific tools that you use with parents to kind of help them dig a bit deeper?
Yeah, so I think nervous system flexibility is a huge one. Like, first thing
Okay.
first is, like, you have to honor where you're at in your nervous system, because you can't pay attention to your nervous system and the chaos around you as a pathway into something deeper if all you're doing is trying to survive it. So really having the flexibility to move in and out of states of tolerant, the window of tolerance, I think does expand our capacity. So I really like The VU by Peter Levine, if you guys are familiar with that one. And if not, go and Google him on YouTube. There's tons of information on it. The VU activates the vagus nerve in the same way that the OM does, and also humming if you do it in a certain way.
Okay.
So, when you hum, or if you voo, or if you om, you'll start to feel a vibration in your chest.
Mhm.
That is stimulation of the vagus nerve. So if we can think of the vagus nerve as like a muscle, it's not a muscle, but just for the sake of this moment, if we can think of it as a muscle that we need to work out so that it can get stronger and better, then we can work with it even in states of non-dysregulation. So maybe in the car or in the shower, or times when you're cleaning the house alone, if you can work with it in a way where you're like, I'm going to build this muscle, I'm going to help this nerve so that it's able to become more flexible when I am in states of distress. I think that's a really great tool and a place to start that's different than,
Okay.
your typical breath work or grounding. Breath work and grounding are wonderful, but this can give you nervous system flexibility, which I think is even more supportive when you're in the moment of dysregulation. So that's one of my favorite tools. And then certainly I think using breath work, teaching children how to use breath work,
Okay.
the in count of 4, hold your breath for 4, and
Hmm.
then out count for 4, which I would actually say 5 or 6, because if you can exhale longer, you'll actually start to come quicker into the parasympathetic state. So I think that there are multiple different tools that you can use, and certainly creating that flexibility, I think is the place that I would start as far as
Okay.
a tool goes.
Got you. Got you. Thank you. Okay. And so you mentioned earlier about being as a family coach, a lot of it is collaboration, right? And so you recommended things like potentially occupational therapy, some neurological integration alongside your coaching work. How do you think about building that full support system for a family? Like, where does that process begin? Like, how do you choose which supports are necessary for a family? And then how do you go about helping that family build that ecosystem?
Yeah, so it starts in the assessment, really paying attention to what I think would be supportive. OT is one that's usually at the top, but the truth is that there are a minimal amount of occupational therapists that
Yeah.
understand or work from that perspective of nervous system
Mhm.
regulation, specifically for children with these high sensory needs. So it's not that it's always easy to find, but we'll do our best to support people in finding the right match. But that's always a go to for me, because that's the beginning of getting core strength to come online. And then these kids often have challenges with like spatial recognition and proprioception and things like that. And OT can do that in a way that, therapists are not trained to do that work. And often
Right.
therapists are not comfortable and are not allowed to even touch a child, right?
Yes.
So that physical touch and that physical movement and work is really important, and usually we'll just start there. I'll often look at people's insurances too, like what can
Mhm.
they afford, right? Because
Yeah.
a lot of these services cost money, but luckily
Mhm.
there are OTs that do take insurance. Back is one that I mentioned. I've seen that most effective with college aged kids that are
Okay.
dealing with ADHD symptoms. And once again, it's not going to look like ADHD to people or what people think ADHD look like. It's basically going to be the college kid that comes in and says, I'm failing my classes. I feel like a failure. I don't know what it is, but whenever I have an assignment, I procrastinate and I don't do it until the last minute. And I'm so stressed out. It's like we hear all those things, but then if we're coming into understanding the nervous system, we can understand that their executive functioning is struggling because they have to sequence all of these things. They have to figure out the time of how long it's going to take them. They have to do all of the executive functioning work, right? And then when they get to the point of doing the assignment, then they get overwhelmed. Their brain goes into a freeze response, and now they're not able to function. But once again, they're not dumb, they're not lazy, they're not good enough, right? All the narratives that people carry. So I'm really looking in that assessment phase of like, okay, well, what's happening here potentially, and like what's going to be the most supportive? But I would say OT is a place that we most likely start. And if we have a family that can't get those services, then certainly and can or cannot, I would say we still start in that psychoeducation, not psychoactive, that psychoeducation stage where we can really get clear for ourselves on, okay, well, what does it look like if a parent comes in and says my kid is just having tantrums every day, to an untrained clinician, that's going to feel like, okay, maybe just a note, they're having tantrums every day, right? But if we're thinking about it differently, it's like, okay, well, what does that look like, and how can we pay attention to maybe what happens before the tantrum, like what creates the tantrum? What does
Right.
the tantrum look like? Is it possibly meltdowns and not tantrums? And then how do we come out of those? So I'm answering in a very long-winded way, just things that are coming through me because there's a ton of information I could give you. But it just feels like in that assessment phase, just really learning and getting as much information as I can as to what's going to be supportive for them. And I will say, just to kind of wrap up that question too, though, is like, this is a gap in our field. This is a problem. And that's why I'm like, okay, what do you do, Nicole, to like fix it, it's like, whew, you know, it is a problem because one of my long-term goals is to be able to create, just like I have with Sacred Path, I've created a place where people can come in and do deeper depth psychology work, holistic work. They can heal in a different way and it's accessible to them,
Yeah.
whereas other health resorts, retreats like that costs a lot more money to go and do something like that. I would love to see this become available to parents who need this so that these supports are available under one roof,
Yes.
eventually in some
Yeah.
way. Because the truth is like it needs, these kids need integrative care. They need integrative
Absolutely.
support. Not one of
Absolutely.
us can
Can do everything.
do all of the work. So it's a gap that needs to get filled.
Absolutely. I completely agree with you. Just the being able to have that level of wraparound services for not just the child, but for the entire family. Because as we've discussed here, it doesn't just start with this child who's having quote unquote behavior problems. Like the things that go deeper than just what seems to be just that child's problem. It goes back through the parents and the parents' parents and a systems issue, period. And so being able to
Yes.
truly help a family bridge all of those things and really work on healing is not just, like you mentioned, not just the work of one clinician. It's impossible.
Yes, yes. And as you say that, I'm really leaning into like my whole philosophy with like the split self. It's like it is a systems issue. And it
Yeah.
is something that, has always been kind of split off or isolated. And now it's something that we have to integrate because I think the statistic that I read most recently, which was some time ago, was like 1 in 25 kids is dealing with this. And I think pretty soon you'll probably see that 1 in 2 kids are dealing with some kind of sensory issue. So
Mhm.
we're living in a world that, isn't supporting their nervous systems and we're being asked to change on a collective level and it's starting at home and it's getting really loud at home. People
Very
who
loud.
identify with this really will feel seen by hearing this information.
Absolutely. Absolutely. And so that brings me all to this incredibly important point that I want to make, or something I'm curious about. Your work bridges so many different things, right?
Yeah.
Just in the span of this 40-minute conversation, we've talked about psychology, we've talked about spirituality, neuroscience, ADHD, sensory issues, neurofeedback, sensory integration. So many different things are at play here. How do you hold all of that together or piece it together or work through it clinically? And then how do you help families honor both that their soul level worth, their meaning, and then the very real, very, very real neurobiological needs of their child? Like how does all that work together?
Yeah. It's very complex.
Yeah.
So I think part of my own nervous system journey, amongst many things, was creating an expanding capacity. The answer is I do have the capacity to hold immense complexity in this world that most people don't naturally hold. So I can take it and organize it. But I will say, as you brought up earlier, I was like, yeah, one place that I don't organize it well is when someone's trying to niche me. I'm like, I don't know. So I don't fit in a box and I'm really good at helping people who don't fit in a box. So I think I hold things on a spectrum of complexity. And overall, I really hold things as really looking through the lens of the nervous system. So I think when it comes to doing our own individual work or the work that we're doing with our clients, it starts for me with understanding the nervous system, right? Like what is their ego strength? What is their capacity for going into the depths? Is this a person that I can take on a deep transformational journey? Or is this going to be a person who I just need to help solve this one issue and teach them some
Mm.
regulation skills and let them move on with this level of their life. So I think it's really a place that I kind of hold this container or lens where I see like, well, where are we starting? And when it comes to working with families and these children, like I said, it's like it's very complex and it does, speak to the gap and the need to bring in all of these different systems to help support the system. But simply said, it really is looking through the lens of the nervous system, right? And even that is like something people aren't readily, or at least not talking about enough yet, is that, ADHD, autism, sensory processing issues, we look at them through this one lens of pathology or something's wrong with my kid. And really what it is it's a nervous system disability. It's a child who's taking in way more information than you or I do, except for I could say you or I do, but we're probably talking as highly sensitive people to highly sensitive people. So by the way, you also take in way more information than the average human being per second.
Yeah.
And, that sensory gating, does that information come in all at once, right? Or are you able to filter and like be in a crowd and feel regulated because your nervous system can tell you that the crowd, is over here and you need to be present with the conversation in front of you. I mean, I'm kind of getting out there, but I'm just basically saying for me, it comes back to really understanding where are we starting with our nervous system, with the nervous system that we're working with. And from there, I have kind of a foundation, if you will, of where we can go and what we need to do.
Got you. This really, it sounds like evaluating a family or a parent's or child's, even their capacity to even accept what you could give them and providing them with that.
Sure. Yeah. And their capacity to do deeper work, right? And a lot of that
Right.
depends, when we think of Maslow's hierarchy of needs, right? It's like, well, where is this family even on the socioeconomic scale, right? Like, do they have their needs met enough that they can move into self-actualization eventually, right? So it's like, for me, the nervous system is really the foundation. I mean, it's so much more than that to me too. But if we want to look at it in the most simplest way that we can, as far as like, how can we take this from this conversation today and start to apply this as clinicians, let's just bring the nervous system in as part of the discussion and as a part of our awareness of where we are and what we're looking at.
Got you. Thank you for that. And so as we come to a close in our conversation today, Nicole, for therapists, coaches, clinicians, people listening that want to work better with neurodivergent families, what would you say are the most important places to start? And where can folks learn more about your work or train with you through Sacred Path?
Sure. So Sacred Path, I will start with that, is a collective of therapists. Most are pre-licensed therapists.
Okay.
We are open sometimes to working with licensed therapists, depending, and we are licensed in California and Nevada. And so that is sacredpathholistictherapy.com.
Okay.
And to work with me, I am drnicoledolan.com, and you can find me on Instagram at Dr. Nicole Dolan. And I'm sure it will all be in show notes. And we are currently working on a couple of courses where we can make this information available to both parents and clinicians. And then certainly I work individually and also do different speaking engagements around this information, and obviously lots of other information too.
Nice. Very nice.
Yeah.
Nicole, I really have appreciated speaking with you again today. This was great.
Yeah, it was really lovely. Thank you for having me again.
And thank you to our listeners for taking the time to join us. Make sure to follow us on all of our social media and Instagram, TikTok, LinkedIn, and even on YouTube at Behavioral Health Today. And if you like our show, make sure to give us 5 stars and leave us a review. That helps our show get discovered and share the valuable insights in each episode. As always, the resources for this episode and an archive of all of our other episodes can be found on our webpage at triadhq.com/BHT. And we look forward to having you back with us next time on Behavioral Health Today.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.